think, you have like the search and rescue team, and they bring the patient down to the parking lot, and then you have the ambulance waiting, and then they take over, and there's that kind of an interface. And Seth Hawkins, who also has the same little hoodie on I do, he's not in Vermont, but he has a connection with us. He wrote a book, Wilderness EMS. Has anybody read the book? Oh,
Mhm.
yay. Okay. Did you
Yes.
guys do his externship or anything?
I'm one of the authors of a couple chapters, as well as Larry on this call.
Oh my goodness. Okay, so you're going to correct me on everything that I say is wrong. But you're going to continue. What were your chapters on?
Cold injuries and also the event medicine chapter.
Oh, phenomenal. Okay, so you
Yeah.
guys are faculty, is that
Yeah.
right?
Yes. Well,
Perfect.
we're both Pharm wilderness medicine people, and we've been following GOWME. So we have nothing else to do with GOWME except we sort of
Oh,
look
okay.
and watch the programs.
Okay. All right. Well, feel free to chime in here. But I don't know if I mean, I think before Seth, there really wasn't much of an awareness of this interface again between EMS, which most people think of as the ambulance, street medicine, and wilderness, and he kind of blurred the lines. Um, so, but I've gotten a little sense of who you guys are. But if you don't mind just putting your video on, you just have to raise your hand, and then if you really want to turn your video off, you can. But who is has a woofer or and I can only see four people. So is there anybody out there? Just yell out if you're a woofer or OEC, which is the ski patrol. Cool.
I
All
have
right. Are
both.
you woofer or who's woofer? Oh,
Not
okay. But okay.
I'm
And what?
working towards it slowly.
Okay. All right.
I'm the
And
STAR
what about?
coordinator for our county, so I'm working gradually to some of those things.
Okay.
And
And then
Linda and
OEC.
I are OEC instructors.
Oh, yay. Okay. OEC and no woofer.
No,
Correct?
no woofer, no woofer. The hand just kind of went up for some reason. So
Okay. Yeah. I don't know. I can't see everybody, so maybe I don't know. Just
I have
yell
a
out.
new computer, so I'm having trouble getting my video up.
Oh, okay. All right, and then we have physicians, bunch of physicians. Any physicians? I know the med students. No attendings. Okay, what about nurses, PAs?
I'm a med student and a nurse.
Okay. Oh, cool. So you can actually start lines.
advanced practice group.
Phenomenal. Okay, is anybody EMS licensed?
Mhm.
EMT,
Yes. Oh, wow. Okay, what is your certification or your license, Linda?
EMT basic.
Yeah,
Okay. Okay.
same.
So you're OEC and um,
Yeah.
EMS.
Yeah.
Okay. Anybody on a SAR team?
Mhm.
Search and rescue. Okay. All right. So you guys kind of, and then, all right, here's a question for you. On the SAR team, for the medical personnel, I know sometimes there are people who are not medical. They do a lot of the other stuff, set up the ropes or just do all the physical labor. What is the certification that's required?
So for our county, we're affiliated with a task force and we utilize when we do search teams, mainly fire rescue personnel. So we don't have a required certification, but typically most of those guys, a lot of those guys that show up on the teams for a search are EMTs or paramedics. And then we have a strong ambulance service that is usually side by side with us as well.
Are they actually going to the patient if the patient's 4 miles up the trail?
Our EMTs that are firemen typically are if they're part of the search teams. The ambulance services are staging, like you had mentioned earlier.
Yeah.
Uh, and we're not a like a we're nothing like out west. We don't have a lot of wilderness areas. It's typically, a few thousand acres of woods where somebody might farm type thing, wilderness where somebody might deer hunt, explore, get injured. But we don't have like the out west cases where we're really being adjacent to Louisville, we're an urban, rural type of community. So we don't get that 2 days deep into the woods type thing.
Okay. Is anybody else on a SAR team?
Yeah.
Yeah. And what is will the medical requirement for those are?
Um, we're affiliated with our ski patrol. We're members of the MRA,
Oh,
and we have to have at least SARTEC 3.
okay, but the SARTEC 3 is not the medical part, right? So they're
Oh, I'm
ski
sorry, I
patrol.
misunderstood.
Oh no, sorry. So they're ski patrol, so they'd be like OEC probably, like outdoor emergency care.
Hmm.
Okay. All right, cool. All right, so that's helpful just to get a little sense of your background. And just quickly, you heard a bunch of from me. But I started like I took a woofer class from solo just because I was hiking a bunch. And then because I like the medicine, a friend said, "Oh, you should take your EMT." I had no sense that I was going to do anything other than take the class. And then I started volunteering. So this was back in the 90s. And so even back in the 90s, I was already kind of doing both EMS or street medicine and wilderness. And then, no, I haven't seen the pit yet. And I don't think I'm going to yet. Um, but then I decided in my 40s to go to medical school. So for those of you who, for some reason, I don't know, if you decide to have a career change in your 40s, you can do it. Um, yeah, and then I did my DIM and as you heard, I went to Nepal a couple times and I did my EMS fellowship at UNM. So it's kind of for those who are trying to figure out, where you're headed, or you may not know where you're headed until you're there. You just keep following your interest in things, and then pretty soon you have a career path and a set of skills that people actually think are pretty good. So after I finished my fellowship at the University of New Mexico, I came back to Central Vermont, and that's where I was when I was working for the University of Vermont, which I stopped doing in September. That's where I was doing the medical direction for like 14 different EMS agencies, and they were anything from, anywhere from very, very rural fast squads to municipal-based critical care paramedic level services to volunteer services that service primarily 3 ski areas. And it's phenomenal. So anybody who is kind of looking for a little niche when you go into emergency medicine, if you don't already have one, I think EMS is phenomenal and it works very, very well with wilderness medicine. I'm still working as an emergency physician. But as mentioned, I'm also the medical director for a EMS academy, and I work in a ski area at their ski clinic, and I sometimes go off to places like Guatemala and stuff. So wilderness medicine, EMS, the combination is, I think, is super great. And there's a lot of overlap, and that's what we're going to talk about today. We're going to talk about the overlap. Disclosure is nothing financial, and I've already bored you with my love for both. I do have to admit that as I go through this lecture, it does kind of sound like I think EMS, in terms of training and all that, is a better level of training than some of the first aid or what we call wilderness medicine. And I'll try to define that a little more clearly. But call me out on it because I started out in wilderness medicine, and which is like the woofer and all that. And I still believe in it. Maybe this is a good place for me to clarify something that, and for you guys who wrote the book or were involved in the book writing, in my head, I couldn't figure out why they were saying EMS and wilderness medicine. I don't know if you have a good way of describing it. Wilderness medicine to most, even from a legal standpoint, is kind of like first aid. Okay. So wilderness medicine, when people say wilderness medicine, they're generally saying like woofers, OECs, and these certifications that are different from practicing medicine. I don't know. Linda, do you want to clarify that?
Yeah, I mean, I think wilderness medicine is broad in that it is kind of both a austere practice and it's improvisation and it's thinking about problems that you encounter in an environment that is resource limited and how you might manage it in that environment. But I think it's also uh, management of problems that you don't typically see in most typical practice settings. So whether it's, plant issues or animal-based issues or, bites,
Yeah.
stings, envenomation, etc. It's
Yeah.
also
So
that.
Yeah, sorry. So the clarification though that I had a hard time with is to recognize that when we say wilderness medicine, we actually are talking about first aid. So it is considered a way of delivering care in a that you're not that is not your primary reason for being out on your SAR team or whatever, but it is if you find that you need to deliver medical care, it's considered first aid instead of EMS, which is considered practicing medicine. We'll get to that a little bit more, but it becomes really important for a lot of reasons, and that's pretty much what I want to talk about today is how are they separate? Um, does anybody have any questions yet? It's kind of weird and murky. Okay. So that's what we're going to talk about. So say like you're skiing in a ski area, and I do want people to speak up if you don't mind. And does anybody ski? Some people ski. Okay. All right. So you totally wipe out, and later this is what they see on the X-ray. So what is this? It's a, it's hard to tell what bone it is. It's a femur.
Humor.
All right. So you got a femur fracture. So my question for you guys is, and I really, please speak. What do you think your care is going to be? So has anybody been injured and had, I mean, you guys are ski patrollers. What is going to be the care that you are going to receive? Anybody? What are they going to do?
Oh, we're going to stabilize, extricate, perhaps put a traction splint on the hill.
Yeah.
We may fix the patient to the backboard and transport them to the aid room, deboot them, and then put a traction splint on. It depends on the situation and the extrication scenario.
Mm-hmm. All right, perfect. So now say you're the patient. What would do you want your care to be? Is there anything else you'd want?
Drugs.
Pain meds.
Yeah, you'd want pain medicine, right? Um, so as you're involved with all wilderness medicine groups now and going forward, think about what you as a patient would be wanting if you were in that situation versus and then think about what your organization is currently offering, and that's gonna be, there might be a difference. Okay, so what determines your care? And that's going to be where you are, right? And we're going to talk about wilderness. Who is delivering that care and what kind of training they have. Those are the things that determine the care that people get when they are injured in the wilderness. So, say you get injured in the street, I think we all know an ambulance is going to show up. Most people know ambulances have a lot of stuff. They might have an EMT. An EMT can't really give you any pain medicine, but they could have an AEMT for us. I don't know if you guys, they're allowed to give Tylenol, IV Tylenol. And if there's a paramedic, they can give you fentanyl and all some of the good stuff. If you're out in the wilderness, you got the people that are going to put you on they're going to do a litter carry out, but as Larry was just saying, and you guys were saying, they a lot of times don't really have pain medicine. But what about if you're right there, kind of like in that gray zone? So, what is, I think it's kind of interesting to me to realize that some people who go out in the wilderness, what's wilderness we'll talk about, they expect that if they get injured, um, they're going to get saved, they're going to get pain medicine, they're going to get all sorts of care. And then you have other people that go out in the wilderness and they just assume that they're on their own. I don't know if any of you guys have sort of like this line in your mind about when do you go from being able to reasonably expect that you're going to get street level of care versus you're way out there and you're kind of on your own. Does anybody, so let's get into the definition of what is wilderness? And we've all heard this a million times. Has anybody seen the Auerbach book? Yeah. So, for anybody who's really like, if you're a medical person and you really enjoy wilderness medicine, I think this is a phenomenal book. Um, and I think they came out with a seventh edition. Paul Auerbach died a few years ago. It's a really great book. But he has this definition of wilderness, which is crazy. I mean, not crazy, but it's not, to me, it's not helpful. So wilderness equals those areas where fixed or transient geographic challenges reduce availability of or alter requirements for medical or patient movement resources. So I don't really know. What do you do with that? So this is where I turn to you as I drink water. Can you just throw out, like, over the years, what definitions of wilderness you have used?
I think austere comes to mind, an austere setting where you don't have your normal tools of the trade.
Okay, and is it time based, or like you can get the tools of the trade in 50 yards, or
I
I
mean,
think it can be both time and resource based
it can
because
be
you could,
delayed definitive care. I mean, wilderness can be in the cabin of a commercial airliner halfway across the Pacific. If what you're working with is what's in that airplane,
so is it a time based thing for you?
it's both.
Okay, yeah, and I think
It's time and resource.
I would agree with that, and I think that it's really um, there is no clear definition, and I think different people have different expectations and different ideas of whether they've crossed into that area where their care should not be expected to be what it would be if they were closer to the road. And when you are in that position of, if you were on, again, if you're on a SAR team, if you're part of a ski patrol or any sort of wilderness medicine group, your thought process should be what um who are the people that we're likely to be helping, and what are their expectations, and should we be meeting their expectations? Should you be carrying, vials of narcotics? Should you be carrying, I mean, at an extreme, should you be carrying an AED? If you have a group of 60, and I'm in 60s, so 70-year-olds who are hiking, like, kind of, you have to make that decision about when and where is that line. Okay, so wilderness medicine. So let's give some silly examples. This is a ski area where I work. So if someone broke a leg here on this trail, um, would you consider that wilderness?
it could
Anybody?
it could be wilderness if you're in the middle of a blizzard and you can't get EMS units in and out, and now you have a
Yep.
time-based issue.
Yep. And you could, so to get, it won't take ski patrol very long to get to that patient, but they take them down to me at the clinic. I don't have narcotics. We don't have narcotics there. We don't have a lot of things there. We have, a few things, but not much. Then EMS has to come get them. And then it's closest, like lights and sirens, is 45 minutes to the nearest hospital. So, they're near doctors, but the doctors we don't have a whole lot. So could be wilderness. So you'd have expect or want a certain degree, your skill set for your ski patrollers there would be one thing, but there's another area up here that you can see. It's called the church, and it's super remote. And in fact, I didn't even know it existed until someone just told me recently. But to get to that, if somebody gets injured in there, ski patrol has to hike 10 minutes with their toboggan and then like bushwhack through some trees and then get into this area. They have to use ropes to lower somebody if they're injured. And then, so it's at least over an hour to get them even to the base. So now, would you want your ski patrollers, again, to have a different skill set, more medications? Like, does anybody think of those two scenarios as indicating anything different for your personnel that say you're the manager of the ski patrol?
Well,
Okay.
I think your ski patrol in that situation, your patrollers need the technical rescue skills.
Yeah.
It it would be lovely to have somebody on the patrol who is capable of providing an advanced level of care, but at a minimum, you need strong BLS skills and you need technical rescue skills to get them out to where they can be managed.
Yep. And as the patient who's being not very smoothly, it's not like I mean, even in a toboggan, it's rough, right? But if you're really injured and you're being lowered and then you're being like carried. There's no wheel being used or anything. Again, I keep going to the pain medicine, but that is probably one of the biggest um, it's probably one of the most difficult experiences for patients that they don't have pain medicine. So if you're going to give your ski patrollers pain medications, that's a whole different setup for your service, and we'll get into that. But I just want to raise the question of like, if you are on the end, if you end up being medical directors for any sort of wilderness medicine groups, you kind of got to figure out who you're serving and what you want them to be able to offer. Um, to the point again of what is wilderness, we've had two very awful floods in Vermont, both on July 10th. One was July 10th, 2023, one was 2024. And to get patients and bring them back to the ambulance and get them to a hospital was like 2 to 3 hours, even in a neighborhood like this. So as I think Linda had said, like if your situation changes in terms of you may think you're front country, but the weather in of itself could cause you to have wilderness. Okay, so now we're going to get into again now. So I brought up the question of where this care is being delivered is a factor when you're trying to figure out what you want your team to be able to have for skills. Um, and now we're talking about the different types of providers. And we talked a little bit about ski patrol, and that's what OEC, right? So for in the wilderness, quite often you see ski patrol, you might have some camp counselors, you have SAR teams, and you do have EMS sometimes in the wilderness. Can anybody think of any other groups of providers who might be giving care in the wilderness besides these groups? No? Okay. So where you are, so does it matter, again, this is getting back to, does it matter which type of provider you have on the street, on the wilderness? Um, do you care what your training is, what your basically your training is for your different providers? And so we're going to go through what the differences are between these groups of providers, the ski patrollers. We don't talk so much about camp counselors because they're mostly woofers and woofas. OEC and ski patrol is OEC. So we'll be talking about ski patrollers, woofers, and EMS. So some definitions, which anybody who is a medical provider knows. Your training is you're going through your classes, right? So if you're in med school, your training is all the stuff you're going through right now. Your courses, your clinicals, whatever, even in through your residency. If you're going through an EMS class, your training is just your classes. And then woofer is, oops, did that just move? Oh, no, there we go. Woofer is your class. So basically, first step is training. And then you get your certification. And for medical providers, that's when you pass your boards. EMT, that's when you pass your national registry exam. And woofer, that's when you take your final exam. Though that's called certification. I think we all kind of know that. You can have certification for flower arrangements. You can do, there's certifications for photography. There's certification just means you took a class, you took an exam, and somebody says that you're good. And then we have the licensure. So again, if you're a physician or nurse or PA or anybody, your state says that you are authorized legally to work in this state. So licensure is state by state. Sometimes there are like reciprocity agreements, but pretty much just state by state. So EMS, this is where we're getting to the differences. EMS is licensed. OEC or ski patrollers are not licensed. Woofers are not licensed. Okay. Does licensing matter? Some would say yes, some would say no. But this is where earlier when I mentioned first aid versus providing medical care, EMS is considered a medical profession. Woofer and OEC or ski patrol they're not considered medical professions. They're considered first aid. Okay. Does it matter? It matters sometimes legally. It matters, I guess, in terms of whether people think that you are a medical professional or not. And so legally, EMS is medical profession and the others are not. Okay. And then, you know this too from credentialing for anybody who is a physician, you know that one of the biggest reasons to not ever leave your job and go to a different hospital is you have to get credentialed. So after you have gone through your training, you've taken all your boards, you got licensed in a state, you still have to be um, credentialed at the service or the hospital where you're going to be working. So if I work at 3 different hospitals in Vermont, each one I have to get credentialed at. If you are an EMS provider and you work at a particular ambulance service, you have to get credentialed there, meaning that they have put you through whatever additional training. They want you to know how to, pull the ambulance up to the ambulance bay. They want you to know how to call into the hospital, etc. So each different agency would make you credentialed, just like each different hospital makes us get credentialed. Okay, so I go through all that I'm trying to show you the differences. We're getting back to, I'm trying to like pull us back, get um, get you to realize in the wilderness, there's different types of care that you may want to give, and you have to think about what are the trainings or what is the certification or the licensure that you want your providers to have to be able to give that. And so when we look at the training step, there really isn't a big difference. So OEC and EMT are probably the most similar. OEC does tend to lead a little bit, it leans a little bit more toward trauma, which is expected because that's what ski patrol is. Um, but as more and more 80-year-olds are skiing, I mean, the number of codes we've had at the mountain is not nothing. And so there is a little bit more medical being added to OEC, but OEC largely focuses on ski related stuff, which makes sense. EMT is a much broader curriculum, and woofer is kind of a blend of the two, I would say. It's a little bit medical, but again, it's also probably more related to the kinds of injuries that you would see in the wilderness. One thing that I wanted to point out was that OEC is one curriculum. So there's only, wherever you take an OEC class, it's going to be one um, one set of, that's what you're going to learn is the same everywhere. Pretty much same with EMT. It's a National Registry curriculum. There are some rebel states, New York, Wyoming, North Carolina, Illinois. Drives us crazy. In Vermont, we have a bunch of hospitals and EMS agencies that also work in New York, and they're very, very different. But otherwise, the other 46 states are all on the National Registry curriculum. And woofer, I think, I can't remember who is taking woofer, but there is absolutely no standardization of curriculum within the woofer. And that's probably one of the biggest complaints about wilderness medicine courses, woofer and woofa, is that there really is, you take a class in one place and you learn a bunch of stuff, and then you could take the exact same class, get the same certification at a totally different place, and it's very, very different. So there isn't really any standardization. Okay, so again, the certification, OEC, you're going to get one card. EMS is one card, but there are a zillion, not a zillion, but there are a lot of different um, wilderness medicine schools that offer wilderness first responder, wilderness first aid, wilderness EMT. And so if you are somebody who's hiring, or you're leading a SAR team, and your requirement is that everybody have a woofer, you're like, okay, we're going to have a good medical crew on our SAR team. And you either require the wilderness first aid or the wilderness first responder, and you get a card. Do you know what the quality of that organization was? Who knows, right? It's a solo or, like Knowles or one of those. Does that make sense? Like, so that's where there's a lot of heat that's being given or has been actually for about 20 years now to these wilderness medicine schools, because pretty much anybody can set up a wilderness medicine school and print out a bunch of cards and certify people. Okay, so the licensure again, this is our beautiful state house. Has anybody been to Vermont? Yeah. I think we used to be the only state house without a metal detector, but we have a metal detector now. So the downside, so the good thing about EMS is that it is licensed and it is considered a medical profession. The downside is it is legislated, it is legalese. So like there's little, all these rules and all this about what's an EMS incident and how do you become an instructor and what is a license? So it's very, very regimented. And I can tell you from personal experience, as I and a few others have tried to create wilderness medicine, like a wilderness medicine credential for EMS providers, that has to go through the legislature to become part of law. And it's been stuck for like 2 years now. So license have it part of licensure and part of the law is good in some ways, but it's a pain in the butt in others. And then credentialing, that pretty much happens regardless of whether you're working at a camp or if you're joining a ski patrol, they're going to credential you, like show you how to pack up the litter and all that kind of stuff. So credentialing is not something that varies based on what kind of certification you're getting. So summary again, I'm just trying to educate you about what the differences are. Woofer, OEC, and EMS are the biggest categories. Training, Woofer is very not standardized. OEC is very standardized. National Ski Patrol is who creates that. And EMS is, except for those 4 states, is a national registry. Certification, it's very varied. The card, who knows what the card indicates? OEC, if somebody has an OEC card that they hand you, you know what they've been through, because everybody who graduates with an OEC certification has passed the same test, basically. And EMS is the same. There are really lousy EMTs and there are really good EMTs, but they've all been through enough of the same training that you can at least hope that you're getting a good one. And then licensure, again, only EMS is licensed. And credentialing, they all pretty much put you through the steps of making sure that you know how to operate at their agency. And then oversight, meaning is anybody checking the quality? Are they doing quality reviews? Are they making sure that your skill set is still good? Do you have medical direction that you can call and if you have a question or anybody who's checking to make sure that you're doing a good job. And pretty much for Woofer, there really isn't. Ski Patrol has something called a medical advisor. It's more somebody who does some teaching. They don't really have that same legal responsibility to assure the quality of the providers. EMS medical directors it's written into the legally stuff that you just saw, exactly what a medical director needs to do. We're responsible for quality insurance, quality improvement, trainings, signing off on cards, making sure people's skills are still good. And so with EMS, there's at least somebody whose responsibility it is to make sure that their providers are good. So again, first aid. First aid means, excuse me, they're not considered medical providers. They're considered people who have been through a training that if they encounter somebody who has some sort of a medical emergency, that they have at least learned the skills. They are considered to be more good Samaritans than EMS. EMS is considered to actually be a job. Okay, so first aid again does not equal providing medical care. That was for some reason my brain would not go there for the longest time. I couldn't really understand why woofers were not considered medical providers, but they're not. Okay. So just getting into legal stuff. You've already seen this a bunch of times. So EMS is licensed. Scope of what they can do is determined by state law. So if you want to do an expansion of scope of practice, like I and my colleagues were trying to do with, we were trying to get make it so that um, uh, advanced EMTs could reduce shoulders and patellas. They can also, paramedics can reduce patellas in the field. Um, anyway, but we were trying to expand the scope so that, if you have somebody up on a mountain with a shoulder that's dislocated, as we all know, the longer you wait until you get them to a place where it's reduced, it takes longer. So if we can reduce the shoulder on top of the mountain, that'd be great. And it's just turned into such a delay because it is so bureaucratic. It's in state EMS law. So that's a downside of having something be the scope of practice being defined by law. Um, and then ski patrol is mostly it's the OEC scope of practice, but the medical advisor or whoever is covering the insurance for the people working as ski patrollers, they can expand that scope of practice if they want to. So that's the nice part of not being part of state law. It's a lot easier for them to expand scope of practice. And then let's see. So liability is usually what people are concerned about too. So EMS is usually covered by whoever they're working for. Ski patrol, if you're a volunteer, then you're basically a good Samaritan. If you're not a volunteer, then they consider it kind of like you're a good Samaritan, but you just have to, you have a little bit higher level of scrutiny. Like you really have to be considered reasonable and not grossly negligent, but it still is pretty low um, liability. And then wilderness SAR is it's only gross negligence would make you them be able to sue you because you basically are considered again under Good Samaritan. And this is just how much immunity you have, meaning protection. And EMS doesn't have very good protection, but usually it's your liability. They're usually covered by insurance. Okay. So we're just going to go through a couple of cases of why it might matter. Again, whether somebody is wilderness EMS trained or first aid. So let's say that you guys are chosen to be the first medical director of a new ski patrol. This is where I really am going to ask for you. What would you want now that we've gone through all the differences? You have the OEC, pretty much it's going to be OEC versus having EMS providers on the Hill. Who votes for them being EMS providers? Anybody? I can't see your hands. And what would be the upside? Why would you have an EMS provider instead of an OEC provider?
There are a lot of areas out west that have EMT as the requirement to get into ski patrol. Some also then require OEC in addition.
Oh, really? And
Mhm.
do you know why they require EMT?
Um, because I guess they're coming in with a solid foundation in EMS. I don't know the rationale for the mountain. Not all of these mountains are national ski patrol mountains, though. They may be under uh, different training,
Uh,
different leadership.
They may be privately. They're all private mountains, but they may be the smaller mountains tend to be OEC because that's the available program that they can access easily. The big mountains that are primarily career or paid patrols very often are EMT basic, but we have friends out west who are paramedic patrollers. They're
mhm.
patrollers. They are able to provide ALS skills on the mountain, which we cannot provide at our mountain.
Mhm.
Yeah, which mountain are you?
We're Blue Mountain, Pennsylvania.
Oh, okay. Yeah, and I think that is largely the reason that people have EMS, EMTs, paramedics, as ski patrollers is that the scope of practice tends to be greater. I mentioned that the if you have the mountain, like where I work, it's OEC, we're first aid. Um, we are far enough away from medical care that, and we have a lot of shoulders that are dislocated for whatever reason. And it would be so nice if our ski patrollers could reduce shoulders.
Mhm.
Um, as I mentioned, we're trying really hard through the state to make it so that EMS providers, from AEMT to paramedic, can reduce shoulders. I don't know if it's ever going to happen. It's so much easier for at the mountain where I work because they're not EMS for if the mountain will say that ski patrollers can reduce shoulders, then it's done. It's not a big deal. It doesn't have to go through the legislature. But the mountain's not going to do that because they're assuming a liability that they just don't really see the need for. So that's why a lot of mountains that really are willing to go through the process of getting scope of practice enhanced. They are using EMS providers. They can also easily, if they have paramedics, easily give pain medication, right? It's just so it goes back to, I know this has been sort of like convoluted, but this goes back to if you're in the position of creating an agency, you want to think about what do I want to offer to my clientele or to the people that I think I'm going to encounter in the woods, and then create your training model around that.
Right. I think a lot of it too is the big mountains, the EMS based model works better for them. We've got a friend who was I mean, you were describing the church at
Yeah.
Sugarbush, where it might be an hour. I mean, unless we have an incredibly complex rescue at our place, we are typically in our bottom aid room in no more than 20 minutes.
Mm,
So if we had, and by that time we can certainly get a BLS unit, if not an ALS unit in for the advanced care.
yeah.
We have friends out west that by the time they do a rescue in the backcountry areas and get them up to their clinic, it may be an hour and a half, 2 hours. So having the ALS capability in the backcountry is to their benefit. And
Yeah. Yeah, I agree. And an interesting case is, and we're going to get to it really quickly, is Taos. I don't know if you've heard about their fentanyl. Anyway, so again, Sugarbush, we're first aid. So if someone gets hurt, they're kind of shit out of luck. They're going to be in a lot of pain for a long time. And in Taos Ski Valley, they are actually an EMS patroller service and patroller crew. And they did a study and got the New Mexico Board of Medicine to approve for EMTs to give intranasal fentanyl on the hill. And so they had to go through the state, they had to get the law changed, but they were able to do it. And so now they have this capability. If they were not in the EMS-based service, they wouldn't have been able to do that unless they could convince Taos to allow them to get they wouldn't be able to get narcotics anyway. So it's just, I know I've been focusing on the pain medicine, but that tends to be the biggest gap in extrications for patients that are out there for more than 10 or 15 minutes.
right.
Anyway, and so what in the Wilderness Environmental Medicine um, magazine, they basically said that it can't be understated the importance of continuing to push for higher levels of care on the ski hill, especially with more and more people hitting the slopes. There's also an article I read that was saying that they don't think it's going to be very long until EMS starts to have a wilderness medicine component to it. So it is going to become part of EMS. I know that in New Mexico, they have for their SAR teams, EMS providers can get a wilderness medicine like additional certificate or training. And once they've gone through that training, then they're allowed to do these additional skills in the backcountry reductions and things like that. So it does seem that wilderness medicine, that definition of like what is expected or that expectation of what kind of care you're going to get, out there is making people have that question about who should be giving this care and what kind of training do they need to have. Hopefully that made some sense. I feel like I just like spewed it out, but any thoughts or questions?
Well, the intranasal fentanyl. How many? Lynn was when was it?
2007. 2007.
2007. We were at the International Congress on Wilderness Medicine in Scotland,
Huh.
and one of the presentations was from a ski patroller in Aviemore up in the Highlands. And back then they were doing intranasal morphine.
Oh,
And you know,
wow.
it was intranasal fentanyl then too. It was
And,
fentanyl.
but the way they put it was, I mean, they were talking their ski patrollers, which were obviously more than first aid. But at the same time, they said our local community, we have a lot of caves, we have a lot of cavers,
Hmm.
and we have a lot of accidents in caves.
Did they
So
do ketamine like down in was that in Chile that they did the ketamine to get the
yeah,
kids?
that was the big rescue there. But
Yeah.
the guys in Scotland were saying, our typical you don't have the medical providers doing the cave rescue typically in that part of Scotland. You had the garage operator, the shopkeeper, the tow truck driver, the people who did the caving. And he said if you get a hip fracture deep in the cave, it's an 8-hour extrication. These guys are going in there with 8 hours of first aid training,
Yeah.
but three
Yeah.
hours of intranasal fentanyl training
Huh.
and the ability to give Narcan.
Huh.
So they could medicate their rescue and extricate them, with pain management. And they said, if we gave too much, we give him some Narcan. But it was just that it was a very essentially they looked at it as a very simple, you know, procedure to teach them analgesia and get the patient out without a great deal of pain.
Yeah, I totally agree with that. I think we just over complicate things. I mean, I know you have to have rules, and you can't just give everybody every ability to do stuff. But truthfully, we have a ski patroller who I don't know if you know the Cunningham method of shoulder reductions. He kind of wink, wink, nod, nod. He gets the family to get them to, bring their shoulders back and somebody else to massage the arm and he gets them in. And it's just like if we just allowed him and someone, if we just like formally trained him and just two or three other people that are around all the time, we could get these people to have their shoulders reduced instead of going 2 or 3 hours before they're seen in the emergency department. But it's
We've
just, yeah.
we've got a friend who has taught raft and kayak guides down in southern Appalachia
Oh, totally.
and taught them how to do it. And
Yeah.
and he says it's worked very well.
Yeah. I know. It's kind of silly. Anyway, you guys are great for listening. Thank you. And yeah. Anything else? I guess I can stop sharing. Oh, there are more people here than I thought. Hi, everyone. Um, any questions? Nothing?
There's also, I don't know if you're familiar with it, there is a new certification out for wilderness paramedic.
Yeah, I saw that. How is that going? Do you know? I know
I
that
have,
isn't that a Seth thing? Anybody know
it's
anything about it?
Seth and I guess Ben and Dave Pfeiffer.
Chris?
There's a group of the core people, and I think it's going well. And I think a lot of it is, I mean, it is a certification, I suppose, but at least it's, previously I mean, we're in Delaware. If we have call it a wilderness rescue, they're very typically short-lived because we don't have a whole lot of wilderness, but they may be off the road. Your street paramedics are the ones, and local EMTs and firefighters are responding. if you're in an area that has a great deal of wilderness and you have that same issue, your street paramedics are the ones who are responding. And are they used to practicing outside of the back of their truck? And are they used to practicing well into the woods where it may be several hours before their patient gets extricated?
So are they paramedics? They have a wilderness certification? They
you,
are.
this program is a certification for paramedics who go through
Yeah.
additional training and certifications to be qualified to be called wilderness paramedics. And it just means they've had the exposure and the training to practice extended out of area care, I suppose, and care for their patients for hours rather than minutes en route to the hospital.
So how it's different from the DIM, except they're, yeah. Yeah. I mean, I think it's all that whole world is trying to figure itself out, right? So I think at least there's recognition that more there's more stuff, more people out there, more people that probably shouldn't be out there with all sorts of, health issues or whatever. So there are more people out there, and there's just this that world of who is going to take care of them, I think is not yet well defined.
Mhm.
Uh,
No.
yeah.
One thing is that for the Wilderness Medical Society, the credits at the conferences are now CAPC accredited. So
Oh, I didn't
EMT,
know that.
yeah, EMTs, I think the first one, we were just in Wisconsin this past summer for the WMS summer meeting. And so, we were able to get our CAPC credit through
Huh.
the attending the classes.
Yeah, that's great. Anyway, well, if anybody has anything else, you can somehow reach out to me or but I EMS and wilderness medicine. It's a good combo.
It is. It is. That's what got us into this in the first place.
Yeah. All right. Well, thanks you guys.
Thank you
Thank you,
very much.
Dr. Stein. Thanks everyone for
Thanks.
joining.
Thank
Take
you.
care.
Very interesting.
Thank you.